Before we start, please remember that this video is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always talk to your doctor or a qualified healthcare provider about any questions you have regarding your health.
Hi there, and welcome. Today, we're going to talk about something called bile duct stones. We'll walk through what they are, how we treat them, and most importantly, what you can do to stay healthy.
You know, it's pretty wild how something so tiny inside our bodies can end up causing such a big problem, right? Well, that's exactly what we're going to explore. What happens when a little stone gets stuck in a place it's not supposed to be?
All right, let's start with the basics. What exactly are bile duct stones? To really get it, we first need to take a quick peek at how your body works. So, think of a bile duct stone as a gallstone that's kind of gone rogue. It moves out of your gallbladder and gets jammed in the main tube, the bile duct, that carries digestive juice from your liver down to your gut.
The best way to picture it is like a traffic jam on a tiny highway. That tube is supposed to have fluid flowing through it, but the stone blocks everything up. And just like a real traffic jam, that backup can cause a whole lot of trouble.
And believe it or not all of these stones are made of the same stuff. Most of them are what we call cholesterol stones. They form when there's just too much cholesterol in your bile. The other kind are pigment stones, which are made from a substance called bilirubin. And you might be surprised to hear this isn't super rare. For folks who already have gallstones, somewhere between 10 and 20% of them will end up with a stone that makes its way into the bile duct. So yeah, it's a pretty common thing that can happen.
Okay, so how do you even know if this is happening? What does your body do to send up a red flag? Let's get into the symptoms you should be looking out for.
Well, the number one sign is usually a sudden pain that just stays. It's typically in the upper right side of your belly. You might also see your skin or even the whites of your eyes start to look a bit yellow. That's a classic sign called jaundice. And a couple other clues, your pee might get really dark and your poop might look unusually pale. Now, sometimes that blockage can get pretty serious and lead to an infection inside the bile duct. And when that happens, doctors look for a specific set of 3 signs. It has a fancy name, Charcot's triad. Okay, so Charcot's triad is basically a 3-part warning sign. You've got 1, a fever, often with chills, 2, that jaundice we just talked about, the yellow skin and eyes, and 3, pain in your upper belly. If all 3 of those things are happening at once, that is absolutely a medical emergency.
But here's the good news. There's a really great way to fix this. So let's talk about how doctors can get in there and remove those stones, gently and effectively.
The main way we do this is with a procedure called an ERCP. I know it sounds a little complicated, but it's actually pretty amazing. First, we give you some medicine to help you relax and sleep so you won't feel a thing. Then, the doctor uses this super thin, flexible tube with a tiny camera on the end to find where the tube opens into your intestine. From there, they use special little tools to gently pull the stone out. So, how well does it work? Incredibly well. This procedure has a success rate of about 85 to 95%. That's fantastic, which is why it's the go-to treatment for this problem.
Okay, so once the stone is out, we've solved the immediate crisis, but there's usually one more step. See, since these stones almost always start in the gallbladder, your doctor will probably recommend having it removed. It's all about preventing this from ever happening again.
All right, we've talked about treatment. But what about prevention? What can you do to help keep yourself healthy and avoid future problems? Let's dive into that. It turns out your daily habits can make a huge difference. Honestly, 2 of the biggest things you can do are keeping a healthy weight and just being active. Moving your body regularly. It really does lower your risk of making new stones. So when we talk about diet, what does that actually look like? Well, it's not about anything extreme. Just focus on bringing more fruits and veggies into your meals. Whole grains are fantastic too, and don't be scared of healthy fats. You know, the kind you get from things like olive oil.
And on the other side of the coin, it's smart to cut back on a few things. I'm talking about sugary desserts, a lot of prepackaged processed foods, and maybe a few less trips for deep-fried fast food. Those things can unfortunately make it easier for stones to form.
You know what else is super important? Eating at regular times. Seriously, when you skip a meal, that digestive juice just sits around in your gallbladder and it can start to form stones. But when you eat regularly, your gallbladder gets the signal to do its job, keeping everything flowing just like it should. Okay,
We're almost done, but this last part is maybe the most important of all. We need to be crystal clear on the signs that mean you need to get help fast.
Listen, if you experience any of these, please don't wait. Head straight to the emergency room. We're talking about really bad pain in your stomach that just doesn't let up, a high fever, especially if you've got the chills, and that yellowing of your skin or eyes we mentioned. Those are your body's biggest warning signs. You have to listen to them.
Wow, we've gone through a lot, haven't we? From what these stones are to how we fix the problem, and even how you can help prevent them. So I just want to leave you with one final thought, a question really. Looking ahead, what's just one healthy choice you can make for yourself starting today?